The city of Corpus Christi will bring affordable housing to the senior community with the groundbreaking of Fish Pond Corpus Christi.
City Manager Peter Zanoni and council members gathered at Buford Street and Hancock Avenue for the turning of the dirt ceremony for the new senior living apartment complex, Fish Pond at Corpus Christi, for current and future Seagull Villa tenants. The new $19 million senior living apartment complex will have 112 units consisting of one-bedroom apartment homes with about 70 parking spaces.
Hi, good afternoon. Annette Rodriguez, Public Health Director. We're going to get started this evening, our first press briefing of the new year. So happy new year to everybody, and thank you for being with us on our first press briefing on COVID-19. So I'm going to start with the county, Nueces County Director, the Nueces County Judge, Barbara Canales, and then she'll turn it over to myself. So thank you.
Good afternoon, everybody. Barbara Canales, Nueces County Judge. I want to wish you all a happy new year, first and foremost. And I want to also tell you that I'm glad to be here with you after so many press briefings in 2020. I feel just good about being here in a year that is 2021. But it's important that I think we start off, and as I share with you, and I have shared with my staff, some of my hopes and my fears for 2021 with regards to the coronavirus. In 2020, I said hope is not a strategy, but there's no doubt we have so many reasons to be hopeful. And when it comes to fear, I am often reminded of the immortal words of Franklin Roosevelt in his first inaugural address, who said that the only thing we have to fear is fear itself. Now, he said this to us as a country that was going through the deepest part of the Great Depression, which, like the coronavirus pandemic, impacted the entire world. And when he said those words, that we only have fear, that the only thing we have to fear is fear itself, he was not dismissing the very real concerns of people who were wondering how they would feed their families. To the contrary, what President Roosevelt was saying was that we cannot allow our fears to prevent us from doing what absolutely needs to be done. And so he called fear that nameless unreasoning, that unjustified terror which paralyzes needed efforts to convert retreat into advance. God, how I love those words. And converting retreat into advance is the same mindset I would like to address with you, because it's what I spoke of last year as we concluded our year, when I talked about how the vaccine lets us play offense after months and months of playing defense. And so again, think about Roosevelt and converting that retreat into advance. And so I'm come to you today excited about the progress that we are making with the vaccines that we have here in Texas and here in Nueces County. And as we get vaccines, we are getting them to people who need them first as quickly as possible, following the guidelines that the state of Texas has given to us. And I just want to say that it's important to commend all of the work of all of those who are involved, from the very federal government and Project Warp Speed to the scientists and researchers who brought us 2 vaccines in a record, really a record amount of time to our state. And of course, I want to thank Texas leadership. And I have been on the phone with Tatum so many times in 2021. And I think we're just January 5 today, right? But Texas leadership has really helped me as a county judge in getting information and vaccines distributed to our city county health department, our hospitals, our CCFD fire department, our healthcare facilities, and so many private providers who are all working to administer the vaccines in a swift manner. And while I commend what everyone has done and what we are doing, I think it's okay to admit it. Nothing can happen fast enough for me when it comes to vaccinations. I want to make sure that every vaccine that we get gets used immediately. I share that philosophy with Director Rodriguez. So we spend a lot of time talking about how to move vaccines into people's arms. And I'm going to continue to push. That's what I do. That's what we're going to continue to do to ensure that Nueces County and our coastal bend neighbors, our regional neighbors, get priority because we need it. Unfortunately, as we know, the sad truth is that our population is more at risk than many parts of the state. We have about 50% more people over the age of 65 than the Texas average. So Annette, as we pivot to 1B, we're going to have some long lines because that's our trigger, age 65. And we have more uninsured people than the Texas average. Annette, that means we're going to have more people at city county health because these folks don't necessarily have a PCP, right? But we're ready for that. And in fact, today I've made preparations that I'm got a letter almost drafted. It'll be ready to send tomorrow, asking the state of Texas to send us more vaccine because we need them, because it's justifiable, and because we're ready. We can help the state of Texas do their job in administering this vaccine in a really good way. Now, unfortunately, the trifecta, remember we have lots of people over 65, lots of uninsured, and this one is the third piece element, and that's we have a higher incident of illness, those chronic conditions that make COVID such a deadly disease, diabetes, asthma, obesity, than the Texas average. So as all of your questions come in, you want to know how it is that we are prioritizing. We're not looking for careers to say, it's your turn, electricians, it's your turn, plumbers, it's your turn, construction workers. All of us are essential, and we know who the most critical infrastructure folks are. What we're looking for are those categories next of over 65 and those with chronic conditions. That's where we're headed next. That's 1B. And so at this stage of the vaccination distribution, supplies are very limited. Okay, I think I heard probably we have about 760,000 in Texas as of yesterday. That's a very limited amount for an entire state population. And our state correctly has prioritized our assisted living centers, those living at risk, to get these vaccines first, including our frontline and our healthcare workers, our emergency transport folks, and our emergency responders. Now, our fair share of the vaccines is not just a math problem of getting our proportion right of the available vaccines. We just happen to have more folks in each of these priority categories than any other part of the state. That's what makes South Texas unique, and that's why it's been such a victory over the past 4 or 5 months to be able to keep our numbers low. That's why we're constantly fighting the spread of this virus. Someone asked me on radio just yesterday morning, now you can't really stop the spread. Well, maybe it's physically or mathematically impossible to go to zero at this time with community spread, but our goal, yes, is to stop it. It's like asking me if I want to eradicate cancer. The answer is yes, we do. But we're going to take better treatments all day long until we get that cure. And that's the same application here. So the factors of age, insurance, status, income, these are all important, and they're called the social determinants of health. It's a phrase I want you to get very comfortable with because like flattening the curve, it matters in vaccination. And knowing how they impact our community is vital to ensuring we get our resources, and we need to serve, of course, these at-risk populations. So, at the beginning of the pandemic, look, we were very focused in county emergency management. We said we're going to follow the science, and we have. We're going to be driven by data, and we have been. And through this, the state of Texas has always responded to us, and we present our needs on solid data. So when I send my letter tomorrow, it's going to be based on science and data that drives this decision to say, I think we can handle more vaccine. I know I share this commitment with city, county public health. I'd like to be able to vaccinate thousands of people a day in city, county public health. We're up to the task, and I know that we need to do this in order to meet our goals in taking care of this vulnerable population that lives amongst us. So, what happens when everyone's trying to get access to the same limited resource? It is not always a question of who yells the loudest. It is a question of who demonstrates the greatest need. So these are my commitments to you. I make my resolution on the 5th of January, my first public press briefing. To you, listening, to our constituents, the state of Texas, I will work as your county judge to get us the vaccines as fast as we can and to get them based on our needs and our ability to administer them efficiently. I will continue to work with all of the providers here in our community to partner and help them with logistics whenever they need so. And of course, I want to pledge to work with City County Public Health to get these administered as fast as possible. That's me playing a strong offense, right? That's us fighting back this disease. And of course, in my metaphor and all of the discussions we had about President Roosevelt, it's advancing, not retreating. So in order for our offense to be successful, we need to continue to play this strong defense. Annette's going to show you that we had over 200 cases today. That defense is serious. We absolutely need that in order to have this victory that we so desperately want. We cannot advance on this enemy if we're going to leave our flanks unprotected. And that's what happens during the holidays. We kind of leave our flanks unprotected. So please continue to do all the things that we've been doing over the past, oh my gosh, we're about to hit a year now, to limit the spread of this virus. It's possibly not your turn to get the vaccine. Just so you know, it hasn't been my turn either. I'm with you. I'm neither over 65, I don't have a chronic health condition, and I'm not a frontline healthcare worker or a person in first response. So I'm with you together. I'm anxious like you are. I want to get vaccines not only for family, for myself, for you, for everybody I work with, but I'm going to ask for your patience because we're doing everything we can to get it to our county as soon as possible. But in the meantime, there's plenty that we can do. Let this be our vaccine for now. Wear that mask. Do everything to prevent that spread. Wash those hands, watch that distance, limit those gatherings. Today, actually, I canceled our State of the County. We're going to reschedule it. We're going to do it virtually. I'm going to bring you those dates. But I've got to be able to practice what we preach. And so it's not a good idea for us to gather in large numbers indoors right now when we're so vulnerable. So all these defensive measures will protect us from spreading the virus, offense in the vaccines, keep us optimistic, keep us hopeful, and let's not let fear paralyze us. Let's keep moving forward. If you need important information about the vaccine, jump on our website. Jump on nuecesnos.com, cityofcorpuschristi.com, or nuecesco.com. We have all kinds of information and videos to help you allay your fears. This is the easiest thing to do in order to suppress this virus, particularly when I see these numbers that we have had, pretty steady numbers around that 200 with that spike of 400 that was enough to put the fear of God in us. And last week when we had that 400 a day, I have to be honest with you, that was scary for me. That's troubling. And it's a trend that we've seen increase. We've seen it increase so much that yesterday we only had one ICU bed available at our county hospital. That's unnerving, and it should be a warning to all of us that following Christmas and New Year's, we just got to be extra, extra vigilant. So we're analyzing all this data. We look for trends over 7 days to see if we need to do anything, if we have to take actions. And we certainly look for any reporting anomalies that contribute to these spikes. So I never regard one day as a spike that means everything is going wrong. But I do think it's an urgent warning to us all. The data doesn't lie. And so while we watch the trends, we're looking at hospital capacity, medical staff, PPE, testing supplies, all of those approved therapeutic treatments. And I want you to have hope because we have so many reasons to be hopeful, and I want you to be free from fear. I want you to believe that your action is the antidote to fear. Let me say that again. Your action is the antidote to fear. And so I'm going to ask all residents to please, in the beginning of 2021, redouble your efforts. Limit yourself to those activities that you need to do. Exercise caution when you're traveling, making trips. Use all the disinfectants that you did in the beginning. Get back to that again. Recommit yourself. Repurpose yourself. Renew yourself and your commitment So make sure that we can wait out our turn for the vaccine. Avoid crowded spaces. Use online whenever you can and curbside delivery. It makes it fast and efficient, and it makes it safe. Our community's health is in your hands. Please do your part by staying safe, staying healthy, and stay informed. Look forward to visiting with you again next week. Of course, we plan on bringing you up-to-date information about the vaccine. And I promise you, when we get it, we will shout it from the mountaintops. Annette's about to let you know we don't have any in City County Health right now. You might find that odd, but I want you to know that throughout our community, there are thousands of vaccines that have been distributed to providers and many that are on their way to different providers. However, I know it can be frustrating to have to be patient and wait, but we are going to push as hard as we can because we know that we can be more effective anywhere else in the state in administering them. So we look forward to updating you within the next possibly 24 or 48 hours. The minute we know, you will too. Thank you so much.
Estoy muy entusiasmada con el progreso que estamos logrando con las vacunas que tenemos. Cuando recibimos las vacunas, las entregamos a las personas que las necesitan primero lo más rápido posible, siguiendo las recomendaciones establecidas. Continuaré presionando para asegurar que el condado de Nueces y el área de la costa tengan la prioridad que necesitamos, porque la triste realidad es que tenemos una población que corre más riesgo que muchas otras partes del estado. Tenemos aproximadamente un 50% más de personas mayores de 65 años que el promedio de Texas. Tenemos más personas sin seguro médico que el promedio de Texas. Tenemos más personas de bajos ingresos que el promedio de Texas. Tenemos una mayor incidencia de enfermedades que hacen de COVID una enfermedad mortal, como el diabetes, el asma, la obesidad, que el promedio de Texas. Ya tengo preparada una petición para el Estado para pedir un mayor número de vacunas, misma que voy a entregar el día de mañana. Estos son mis compromisos con usted y con el Estado de Texas. Trabajaré para obtener todas las vacunas que podamos lo más rápido posible, según nuestras necesidades, y continuaré trabajando para que se administren las vacunas lo más pronto posible. Puede que no sea su turno de vacunarse, pero todos deben hacer su parte para prevenir la propagación del coronavirus. Recuerde utilizar su cubrebocas, lávese las manos, mantenga su distancia y limite estar en grupos. La semana pasada tuvimos un día en que reportamos más de 400 nuevos casos de COVID en el condado de Nueces. Esa fue una noticia preocupante. La tendencia es que nuestro número ha ido en aumento y tras las vacaciones de Navidad y Año Nuevo estamos muy atentos. Estamos analizando los datos para ver si necesitamos tomar medidas para contener los brotes locales y para poder ver si alguna anomalía en los informes contribuyó a este fuerte aumento de casos en un día. Mientras observamos las tendencias, también estamos observando de cerca la capacidad de nuestro hospital, el personal médico, el equipo de protección personal, los suministros de prueba, las vacunas y los tratamientos terapéuticos aprobados. El día de ayer solo contábamos con una cama disponible en la unidad de cuidados intensivos. Pido a todos los residentes que redoblen sus esfuerzos para limitarse a las actividades esenciales y que tengan precaución al realizar viajes. Use toallitas desinfectantes para limpiar superficies. Evite los espacios llenos de gente. La salud de nuestra comunidad está en nuestras manos. Haga su parte manteniéndose seguro, saludable e informado. Ahora la directora del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte.
Thank you, Gabby. So I'm going to go ahead and start now with the COVID-19 statistics. So first slide, please. So on the first slide, what you're going to see is the 2 weeks from December 23rd to January the 5th. And the first week, the week of the 23rd, it's actually, if you totaled them up, it's 905 COVID-19 cases in 1 week. But if you look at the second week, and it starts from 141, 436, 156 cases, all the way to 201 cases today, if you add those up, it's 1,422 cases in 1 week. Again, it's obvious the trend is going up. We continue to see our numbers continue to climb, and that is not the way that we want to be going. So we need to watch this, and like the judge said, be very vigilant about the things that we have been talking about for public health strategies. Next slide, please. For the pie diagram, what you see and what's most important is the active cases. So if you take the active cases, the 2,575 cases, If you take the recovered, the 27,212 cases, and you take the number of deaths and you combine them, it's a total of over 30,000 cases in Nueces County, 30,390 cases as of today. So what we're most concerned with is the active cases, because this is the number of people that actually have COVID-19 in Nueces County currently, 2,575 people that could actually still be spreading that virus. Next slide. The hospitalizations, if you look at them, it may look like a straight flat line. It is not. The number of hospitalized patients with COVID-19 individuals is rising. If you look at 2 weeks ago, we were at 154 patients that had COVID-19 in the hospital. And if you look at today, we're closer to 181 individuals in the hospital with COVID-19. Next slide. These are COVID-19 patients in the ICU. This line continues to be high. It continues to be in the 50s now, but it seems to, stay kind of at that level. And when it does go up, it creeps really up, every day. But that's not because everybody's recovering and going home. Some of these individuals will pass away in the ICU because they cannot survive the COVID-19 outcomes. Next slide. So we're at a total for COVID-19 deaths, we're at a total of 561. We did have 4 deaths today. So my condolences, and from all of us in public health and from the city and the county, our condolences to all of these individuals that lost their loved ones. Starting out a new year without your loved one is just heartbreaking. Next slide, please. And these are actually the number of deaths per week. And so if you look at the first week, the week of December 23rd, you have 13 people that died of COVID-19 last week. And this week you have 17 individuals that died of COVID-19. So these individuals that passed away today, they were in their 20s, in their 30s, in their 60s, and in their 70s. I will now turn it over to Gabby, who will translate before we move into a public health update. Thank you.
En las últimas 24 horas se han reportado 201 casos confirmados por el coronavirus. 27,212 pacientes se han recuperado por completo. 181 personas continúan en el hospital. 52 están en la unidad de cuidados intensivos. 2,575 son casos aún activos. El día de hoy se reportan 4 fallecimientos. A la fecha, los fallecimientos totalizan 561 personas.
Thank you. So we're now going to do question and answers for COVID-19. So we're having a lot of emails, a lot of phone calls, a lot of messages asking a lot of questions about, like the judge mentioned, where is the vaccine? When can I get it? Where do I line up? How do I register? So we developed frequently asked questions, which is also on our website, cctexas.com, under new updates. But we're going to do frequently asked questions for you now. Oh, okay. So the first question is, where can I go to get vaccinated if I'm in phase 1A or 1B? So, and we all know the phases 1A and 1B. We've talked about them, and they should be up here as well, so you'll see the phases. But so where can I go to get vaccinated? You can get vaccinated through any provider that has COVID-19 vaccines. A list of providers can be viewed on our website at cctexas.com/coronavirus under recent updates. Individuals that do not have a provider or their doctor, their provider, did not sign up to be a COVID-19 vaccine provider can get them at the health district. They could also get them through the FQHC, which is Amistad. The health district drive-thrus are on a first-come, first-served basis for those that qualify under the open phase, phase 1A or phase 1B. You can also check the Texas COVID-19 vaccine provider map to view who the providers are in this area.
Algunas de las preguntas frecuentes en cuanto a la vacunación contra el COVID. ¿Dónde puedo vacunarme si estoy en la fase 1A o 1B? Usted puede vacunarse a través de cualquier proveedor que tenga vacunas COVID-19. Una lista se encuentra en el portal www.cctexas.com/coronavirus bajo actualizaciones recientes. Si su médico no está inscrito como proveedor, entonces podrá obtenerla en cualquier unidad de salud del Distrito de Salud.
Next question. How do I sign up to get vaccinated? Is there a pre-registration or a sign-up somewhere? Answer. The Health District registers qualifying individuals on site at the drive-thru. We ask that you bring your cell phone and a short-sleeve shirt to facilitate the administration of the vaccine, and we will help you register prior to receiving your vaccine. Also, it's important to note that other providers have different registration processes. So if you're calling a different provider that has vaccine, please make sure that you ask them the process before showing up.
La siguiente pregunta, ¿cómo me inscribo para vacunarme? ¿Hay alguna preinscripción o registro en algún lugar? El Distrito de Salud registra a las personas calificadas en el sitio, que se encuentra en la clínica de vacunación COVID-19. Le pedimos que traiga su teléfono celular y una camiseta de manga corta. Los proveedores de la vacuna COVID-19 tienen diferentes procesos.
Next question. Why do some people get pre-registered? So nobody's getting pre-registered currently, just so everybody knows that. With the Health District COVID-19 Vaccination Clinic, individuals who qualify for the second dose, we don't have anybody that qualifies for the second dose yet, but individuals that qualify for the second dose will be allowed to pre-register. The second dose recipients will get a reminder that their second dose is needed, along with a link to pre-register. It is important that you register on a day that you can actually attend the drive-thru. If you miss your appointment or vaccines are depleted before you arrive to receive your second dose for the drive-thru, come to the next drive-thru clinic. Show up early since vaccines are still limited. Everyone will be offered the same pre-registration method when it is time for your second dose.
¿Por qué algunas personas se preinscriben? Queremos clarificar que no existen preinscripciones. Con la Clínica del Distrito de Salud, las personas que califiquen para la segunda dosis podrán registrarse previamente. Los receptores de la segunda dosis recibirán un recordatorio de que se necesita su segunda dosis junto con un enlace para preinscribirse. Regístrese en un día en el que pueda asistir. Si falta su cita o si las vacunas se agotan antes de recibir su segunda dosis, acuda a la siguiente ronda de vacunación.
Is there a cost associated with the vaccine? The Health District is currently offering the vaccine for free, so no, there is not a cost if you're coming to the Health District drive-thru. We will continue to offer the vaccine free of charge until the community has all been vaccinated and there's no longer any more vaccines needed by our community. But private providers, doctors' offices can charge an administrative fee. If your doctor is charging, check with your insurance provider to see if the cost will be covered.
¿Hay algún costo asociado con la vacuna? El Distrito de Salud ofrece la vacuna gratis. Continuaremos ofreciendo la vacuna gratis a la comunidad hasta que ya no se ofrezcan más vacunas. Los consultorios médicos pueden cobrar una tarifa administrativa. Si su médico está cobrando, consulte con su proveedor de seguro para saber si va a cubrir ese costo.
Next question. Where is the Health District administering these COVID-19 vaccines? So currently, we are administering the vaccine at the Borchert Fairgrounds, which is at 1213 Terry Shamsey Boulevard, Robstown, Texas, 78380, but only if vaccines are available. We currently have no vaccines at this time, so there's no reason to line up and to get in line currently because there is no vaccine at the Health District at this time.
¿Dónde se está administrando las vacunas del COVID-19? Actualmente se están administrando las vacunas en el Centro de Exposiciones Richard Borchert, ubicado en el 1213 Terry Shamsey en la ciudad de Robstown, aunque la ubicación puede cambiar o cerrar, aunque hasta este momento no se cuentan con vacunas disponibles.
Next question. What days are the Health District clinics at the Richard Borchert Fairgrounds? So since we don't have vaccine, we don't know what day it will be. The Health District has been working hard to open up our clinic the same day that we actually receive the vaccine. So that changes just depending on vaccine availability and when it arrives.
¿Qué día está abierta la clínica móvil de Distrito de Salud? Las fechas en este momento no están disponibles hasta que exista la disponibilidad de la vacuna.
When do you receive vaccines? When does the health district receive these vaccines? We receive notification of arrival of the vaccine the evening, the night before the vaccine arrives. This is done to assure the safety of the vaccine. Once we receive confirmation of the arrival, we send out a news release, and we encourage everyone to watch the news or follow the health district's social media as it is also posted there.
¿Cuándo se reciben las vacunas? Recibimos una notificación de la hora de llegada la noche anterior a la llegada de la vacuna. Una vez confirmada su llegada, enviaremos un comunicado de prensa. También le pedimos que esté siempre poniendo atención en las redes sociales.
What time does the clinic open and how long does it stay open? So once we receive the vaccine, and for the last 2 weeks, we've received the vaccine between 10:30 and 11:30 in the morning. Once we receive it, we try to open the clinic about an hour and a half after the arrival of vaccine. The vaccine arrives frozen, and we have to properly thaw the vaccine before we can administer the vaccine. So get there on time, but not before the time we open so that we can set up the drive-through accordingly.
¿A qué hora abre la clínica y cuánto tiempo permanece abierta? Nuestra clínica abre aproximadamente 1 hora después de la llegada de la vacuna. La vacuna llega congelada y deben de seguir los protocolos de descongelación para garantizar que la vacuna se mantenga viable.
If you receive vaccine at 10:30 in the morning, what time might the clinic open? The clinic would probably open between noon and 1 p.m., and that's determined by the vaccine that we receive, either Moderna or Pfizer, and it's at the Borchert Fairgrounds in Robstown.
Si recibió la vacuna a las 10:30 de la mañana, ¿a qué hora puede abrir la clínica? La clínica probablemente abrirá alrededor del mediodía. Ese mismo día, en el Centro de Exposiciones Borchert es donde se llevaría a cabo la clínica móvil.
How do I prove that I have certain chronic medical conditions that you call comorbidities? You do not have to prove that. The health district believes that people are good and would not lie to cut in front of others that are more vulnerable to getting this virus. The phases were set up by an expert panel of professionals set up by the Department of State Health Services to help those that are more likely to be infected with COVID-19 to get their vaccine first. If you meet the criteria to be vaccinated, please, by all means, show up at one of our vaccination clinics.
¿Cómo pruebo que tengo ciertas condiciones médicas crónicas? Usted no tiene que probarlo. El Distrito de Salud confía en los residentes. Las fases fueron establecidas por un panel de expertos para ayudar a aquellos que tienen más probabilidades de estar infectados con COVID-19 o que desarrollarán síntomas más críticos después de la infección. Si cumple con los criterios para ser vacunado, preséntese en una de nuestras clínicas de vacunación.
Why were essential employees not mentioned in the first or second phase? The phases were defined by an expert panel consisting of healthcare, medical, public health professionals that had to decide who was at higher risk for contracting the COVID-19. While the phase may not say essential employee, you still may fall into phase 1A or 1B, for example, if you're over the age of 65 and have chronic medical conditions.
¿Por qué no se mencionó a los empleados esenciales en las dos primeras fases? Si bien es posible que la fase no diga empleado esencial, aún puede caer en la fase 1A o 1B, si tiene más de 65 años o padece enfermedades crónicas.
Why are some nursing home residents not vaccinated yet? Health and Human Services oversees nursing homes. They had a system set up for them to be vaccinated by the larger pharmacies such as CVS, Walgreens, etc. The nursing homes were scheduled to start getting vaccinated for both their employees and residents on December the 28th of 2020. There are many of these facilities in Texas, so the rollout seems slower than we would have liked for it to have been. We know this population is extremely critical, and as such, the health district, as well as Corpus Christi Fire, have offered to vaccinate them as vaccine becomes available. Some have taken our offers, and others have chosen to wait for the corporate decision for their vaccines to arrive by CVS or Walgreens.
¿Por qué algunos residentes de hogares de ancianos aún no están vacunados? Salud y Servicios Humanos supervisa los hogares de ancianos y establecieron un sistema para que sean vacunados por las farmacias más grandes como CVS, Walgreens, etc. Se programó que los hogares de ancianos comenzarán a vacunarse desde el 28 de diciembre del 2020. Sabemos que esta población es extremadamente crítica y el Distrito de Salud y Departamento de Bomberos se han ofrecido a vacunarlos a medida que la vacuna esté disponible.
How can we help? Is there anything we can do as a citizen to help you guys? Absolutely. Get vaccinated when your time arrives and be patient with us. Our goal is to vaccinate our entire community. The vaccine is not mandatory, but we highly recommend that you receive the vaccine. If you decide to get vaccinated when it's your time, ensure your phone is fully charged and wear a loose-fitting shirt so you can easily roll up your sleeve. When you arrive at the clinic, we will try to inform you as soon as possible if we run out of vaccines. We do not want to make you wait any longer than you have to. If we run out, you can choose to wait for our next drive-thru or visit any of the other providers, doctors' offices that have the vaccine as well. But making sure you call ahead, as these places have different processes than we do. We are working as fast and hard as possible to get everybody vaccinated. You will be vaccinated soon.
¿Cómo podemos ayudar? Vacúnate cuando llegue tu hora y ten paciencia con nosotros. Nuestro objetivo es vacunar a toda nuestra comunidad. La vacuna no es obligatoria, pero le recomendamos que la reciba. Si decide vacunarse cuando sea su momento, asegúrese de que su teléfono esté completamente cargado y use una camisa holgada. Cuando llegue a la clínica, intentaremos informarle lo más pronto posible si nos hemos quedado sin vacunas. Si se nos acaban, puede optar por esperar hasta nuestra próxima clínica móvil o visitar a otros proveedores.
Next question. Can I get COVID-19 vaccine if I just got my flu shot? No. It is not recommended that you get your COVID-19 vaccine within 14 days of any other vaccine.
¿Puedo recibir la vacuna COVID-19 si acabo de recibir la vacuna contra la gripe? Si acaba de recibir su vacuna contra la influenza o cualquier otra vacuna, se recomienda que espere al menos 14 días antes de recibir la vacuna contra el COVID-19.
Can I get the COVID-19 vaccine if I already had coronavirus? Yes, you may still get the vaccine. However, you can wait up to 3 months after you were diagnosed with COVID-19 because you may still have antibodies that can protect you for those 3 months.
¿Puedo recibir la vacuna COVID-19 si ya tenía coronavirus? Sí, aún puede recibir la vacuna. Sin embargo, puede esperar hasta 3 meses después de que le diagnosticaron el COVID-19 porque es posible que tenga anticuerpos que lo protegerán durante al menos 3 meses después de contraer el virus.
What if I'm pregnant, lactating, breastfeeding? Can I get vaccinated? It is important that you discuss receiving the COVID-19 vaccine with your OBGYN before making that decision. Making an informed decision with your OBGYN input will be as important to ensure that they are monitoring your baby's growth. Neither Pfizer nor Moderna did any clinical trials with pregnant or lactating women, so we do not have enough information on how these individuals fared. While we believe it is safe and an efficacious vaccine for the whole entire population, the data is still not sufficient, nor has it been collected to prove its safety in this particular population. Getting the COVID-19 vaccine is a personal decision that only you can make.
¿Qué pasa si estoy embarazada o amamantando? ¿Puedo vacunarme? Hable con su médico antes de tomar esa decisión, quien se asegurará de monitorear el crecimiento del bebé. Ni Pfizer ni Moderna realizaron ensayos clínicos con mujeres embarazadas o lactantes. Los datos no son suficientes ni se han recopilado para demostrar su seguridad en este grupo de población. Recibir la vacuna COVID-19 es una decisión personal que solo usted puede tomar.
What if I have an immunosuppressed disorder? Can I get the vaccine? Yes. It is important, though, that you talk to your primary care physician. Once you have made the decision, along with your medical provider's input, you can get the vaccine. Clinical trials showed that vaccine was safe and efficacious, but because you are immunosuppressed, you may not receive as robust a response as someone that is not immune compromised. Getting the COVID-19 vaccine, again, is a personal decision that only you can make.
¿Qué pasa si tengo un trastorno inmunodeprimido? ¿Puedo vacunarme? Sí, pero hable con su médico. Tras tomar esa decisión puede recibir la vacuna. Los ensayos clínicos mostraron que la vacuna era segura y eficaz, pero debido a que está inmunodeprimido, es posible que no reciba una respuesta tan sólida como alguien que no está inmunodeprimido. Recuerde que tomar la vacuna es una decisión personal que solo usted puede tomar.
What if I'm currently sick with COVID-19? Can I go get vaccinated? While you are sick and a recent COVID-19 diagnosis, it is not recommended that you receive the vaccine. Once you have recovered, you may receive the vaccine. You can also wait the 3 months after being diagnosed and recovered from COVID-19 because your body would have made its own natural antibodies that may protect you for up to 3 months. This virus is still so novel, we do not know how long you really have protection against reinfection. Yes, you can get vaccinated for COVID-19 if you've had the virus. We do not want to get sick in our clinics because most of us, while we've been vaccinated, not all of us have had the second vaccine at this time.
¿Qué pasa si actualmente estoy enfermo con COVID-19? ¿Puedo vacunarme? Mientras esté enfermo, no se recomienda que reciba la vacuna. Una vez que se haya recuperado, puede recibir la vacuna. Podría esperar para recibir la vacuna hasta 3 meses después de haber sido diagnosticado y recuperado del COVID-19, porque su cuerpo habría producido anticuerpos naturales que pueden protegerlo hasta por 3 meses. Sí puede vacunarse contra el COVID-19 si tuvo el virus en el pasado. No queremos a nadie enfermo en nuestras clínicas porque aunque la mayoría de nosotros nos hemos vacunado, no todos lo hemos hecho y ninguno de nosotros ha recibido la serie completa de las 2 dosis requeridas hasta este momento.
Can I be forced to get vaccinated? No. This vaccine was approved by the Food and Drug Administration, the FDA, under a EUA, an emergency use authorization, and therefore you cannot be forced to get the vaccine. The health district strongly recommends that you get vaccinated, but we will not force anyone to be vaccinated. This, again, is a personal choice. We do encourage as many people to get vaccinated as quickly as possible. The more people that are vaccinated, the faster we will be able to put this pandemic behind us.
¿Me pueden obligar a vacunarme? No. Esta vacuna fue aprobada por la Administración de Alimentos y Medicamentos bajo una autorización de uso de emergencia y por lo tanto no puede ser obligado a recibir la vacuna. El Distrito de Salud recomienda que se vacune, pero no le obligará a vacunarse. Esa debe ser una elección personal.
Do these vaccines, and this is the last question, do they cover the new variant strain that we're all hearing about? And the answer is yes. At this time, the vaccines, the Moderna and the Pfizer, do cover these 2 new mutant strains, the B.1.1.7 from the UK, as well as the B.1.35.1 out of South Africa. The vaccine will keep you from getting those 2 particular strains the way they are currently. Remember that vaccines, viruses mutate, and they could mutate more, and then the vaccine could possibly not cover those particular vaccines. But right now, those 2 strains we're hearing about in the UK and South Africa are covered by this new vaccine.
¿Cubren estas vacunas la nueva cepa, la que ha mutado? Sí, ambas vacunas, Pfizer y Moderna, cubren las nuevas cepas que han mutado, de las que usted ha escuchado últimamente en el Reino Unido.
That concludes the press conference for today. Are there any questions? Seeing none, thank you. Again, Happy New Year to everybody. Thank you for being with us, and we will be here again next Tuesday at 5 p.m. Thank you.